Hey, happy, beautiful, amazing day. Dr. Bob Rakowski here out of Houston, Texas. This morning, I received a question about endometriosis. And, when I look at these pictures, I'm beyond amazed at how many women suffer and aren't really finding adequate solutions. So I'm going to share some information that I know to be very, very valuable. First and foremost, it's actually estimated that about 15% of women have this to some degree. And really, the only way they can tell is by doing some either very sophisticated imaging or even a surgical exploration of the abdomen. So I always like to answer these questions. What's causing the problem? Can I help? By the way, my answer is always the same. I don't know, but I'll try, but I'll share a protocol that's been very helpful. How long will it take? Bodies respond to frequency, duration, intensity, quality, and timing of stimuli. How much does it cost? Well, we're going to look at that. But in terms of cost, I always like to quote that the most expensive therapy is the one that doesn't work. And sadly, people have had therapies that have not helped them and may have even moved them in the wrong direction. So here's probably what's causing the problem. I like this quote and don't like it. We're swimming in a sea of estrogens. There's estrogens in plastics, estrogens in pesticides, estrogens injected into animals. And what we're going to find out is that estrogen actually causes the endometrial lining to grow. And what we know is that, interestingly enough, the ovaries have a gap between them and the fallopian tube. So when an egg ovulates, these little thing called fimbriae actually grab the egg and bring it down into the uterus for potential fertilization and implantation. So there is a connection between the pelvic cavity and into the abdominal cavity. And it's estimated that all women have some of this, what they call retrograde menstruation flow. So ultimately, the immune system is supposed to take care of the endometrial tissue that gets outside of the uterus. And so this article is entitled Pathophysiology and Immune Dysfunction in Endometriosis. And some even suggest that there's an autoimmune component, definitely a suboptimal immune component. So this is a little out of sequence, but these estrogens cause the uterine lining to grow. And again, estrogens in plastics, pesticides, and injected into animals seem to have this effect as well. So since there's immune dysfunction, I talk about 6 universal immune balancing strategies. You want to seal and heal the gut. You do go with vitamin D, Ganoderma, Periliseed, Resolvins, and DHEA. And these are things that we've found to help whatever type of immune imbalance. It could be allergy, it could be autoimmunity, could be infection, could even be cancer. When you make the immune system better, we have a better probability of beating all of these. I created a nutrition pyramid years ago. The base is going to be nature's food. We're going to go with organic foods because we don't want them genetically modified. We don't want them sprayed with xenoestrogens. Superfoods, top superfood on the planet, Ganoderma lucidum. Functional foods, there's foods that help to either seal and heal the gut or clear the toxic estrogens. A good multivitamin, multimineral, omega-3s with resolvins, very powerful immune modulation, probiotics, and a combination of D3, K2. And I make good use of all of these things. And when we start talking about the pain, there's a huge inflammatory process. Ganoderma is not only an immune modulator, but it's anti-inflammatory by at least a dozen proven mechanisms. And it has the benefit of actually helping endometrial cancer as well. So my favorite way for Ganoderma, infused coffee and teas. We find out that people make a better choice. They feel better on it. They usually do it multiple times a day. And so much of their health picture improves. Every Tuesday, I have something called Ask the Doctor. There is the meeting ID and the password. Feel free to join us on the Zoom every Tuesday. And as always, I'm Dr. Bob Rakowski, absolutely knowing that we can all be happy, healthy, and successful.